Hello everyone, welcome to Move Well, Live Well. We get a number of people that come in here who are expectant mothers. And what's happening with expectant mothers is they're having issues with their hip. They're having a lot of hip pain, especially as they move into their second and then their third trimester and all the way up to having baby. So we have a substitute expectant mother and Dr. K here that's going to help us out with this video. Some things that you can do. What we're finding with these expectant mothers is that their glute medius muscle is just on fire, because as they get into their second and third trimester, they start, women have a tendency, and when they're expecting, they have a tendency to start waddling. So their gait, their steps are starting to become kind of like a pigeon kind of waddle, if you will. And so their glute medius muscle, which is a muscle that allows you to bring your thigh to the side like this, bring your leg, raise your leg up laterally, and it's just smoked. It's just tired and fatigued, and it starts to cramp and ache, and sometimes you even get pain in the butt, and sometimes even going down, referred pain down on the side of the back of the hamstring, sometimes even to the calf, and it's giving them a lot of discomfort. So how do you fix that? How do you help these expectant mothers so that way they get alleviation of that pain and they can continue to go about their activities as best they can without so much discomfort in that hip? So I have pretend expectant mother, Dr. K here. She'll be helping us out. So if you take a look at Dr. K here, the glute medius again is medial. So this is the glute, and medially is right through the lateral part or the side part. Just you can kind of palpate here, and there's a ridge of bone. This is the ilium or the hip bone. Well, a lot of people like to call it the hip bone. The actual hip bone is where that ball and socket fits. The head of the femur fits into the acetabular, but a lot of people call this the hip bone. But really, this is the ilium, or part of the pelvis. It's part of the pelvic bone. The ilium here is the top. And then right in here, you can palpate this is the glute, the glute medius would be here. So as you palpate in here, you can take the expressions on your significant other or your wife's face as to where the tender spot is in that glute medius. And what you do is you get your handy dandy foam roll. Awesome. You can also use a rolling pin, but the rolling pin sometimes causes a little bit more discomfort than women would like. I find that using a relatively, you can kind of see this is a foam roller, and you can kind of see it's kind of smushy in here like that. You see that? And it provides a lot more relief. You can kind of get in here like this. It provides a lot more relief into the glute medius. So you just find those tender spots and just kind of work those way out. And you can kind of get the expression from your wife. She can give you feedback, or your significant other get you feedback as to whether or not this is causing discomfort. So right in here, just like this. See that? Right in here. Find those, search around, find those tender spots. Do that 3 to 5 minutes into that spot. It'll help start relaxing. It'll help break up some of the adhesions that have developed sometimes within the glute medius. It helps decrease that spasm in through there. It helps to increase circulation in through there as well. And sometimes you get some of the adhesions between the skin, the adipose tissue, and the fascia and the muscle, and they just come pancaked together and kind of like matted tissue. I don't know if you've ever seen matted hair on a dog. Those fibers just kind of haphazardly are laid down there. And by doing this, you help break that stuff up for your wife or significant other, your expectant mom that is about to have baby. So there's that you can do. And then after you're done with that, do a little bit of a stretch. So what I have folks do is I have the expectant mom come a little bit closer toward the edge of the bed. This could be a bed, a couch. Make sure they don't fall over. That's bad for mom. So don't let mom fall off the couch or bed. So you can have them here, and you can kind of see how Dr. K is kind of laid here, kind of on the edge of the couch. You can kind of see how she's put her upper thigh into, this is adduction. So this is adduction. This is abduction of the thigh, right? Of the thigh. And this is adduction. This is adduction. This is abduction, right? And remember, the glute medius does abduction. So waddling in, with the legs wide, kind of like this all day long, this guy gets smoked. So how do we fix that? Well, we've rolled it out a little bit. Now we take it into adduction, adduction here. And we can even bend the knee like this, kind of bend the knee like this, and you can even take it into external rotation. Let me see if I can get the camera down a little lower. There's that right there. And you can see I have here, make sure she don't fall off. I'm in a position here so it's easier for you to see what I'm doing. But ideally I'd be here supporting her like this, so that way she don't fall off. See, this is the position that I would normally take, so that way your significant other doesn't fall off the table. And then I would take her leg into adduction, and this is external rotation of the femur. All right, be careful not to tweak your significant other's knee. So you're going to get feedback from them as to whether or not the knee's having a problem. But you're taking just this into external rotation, just like that. You're just going to oscillate back and forth, just like that. So for demonstration purposes, I'll be over here so you can kind of see. So again, her thigh is an adduction, and I'm taking her foot from here to here. See that? And I'm getting a little bit of external rotation within that hip, within the rotator muscles of the hip. You feel that? That's good stuff, yeah?
Yep.
It's good stuff here. And you can even do a contract relax where she has the thigh all the way off the table here, just like this. See that? It's off the table. And you can even do a contract relax where you have them push up against you just a little bit and then relax, and then push up against you a little bit and relax, and you can get more range. I don't know if you can see that. Let me move this down here a little bit. There. So now I can further take her into adduction. Go ahead and contract, relax. Good. You see that? See how much more range, more adduction I've gotten out of this glute medius here. Okay? And again, I can bend the knee, flex the knee, and I can take her again into external rotation this way. Just like that. And I can oscillate back and forth. And how's that feel?
Feels good. Feels
good. So this is going to feel great for your significant other who is typically hip pain. As baby gets larger and larger, the hip pain becomes more increasingly discomforting as they get into a second and third trimester. So again, step number one, you're going to foam roll that glute medius, right? Foam roll it to your significant other's pain tolerance. You don't want to have them, they'll kick you anyway. If it's too much pressure, they're going to kick you anyway. So I usually recommend, distal to towards the heart. So towards the heart, right? As you're doing this. And after you're done with doing this, you're going to take it into a stretch. So you're going to adduction, right? Because the glute medius does what? It does abduction. It does this. Abduction. Abduction. And this is adduction. So you're going to have them come towards the end of the table. You're going to make sure you're going to block them. You're going to be over here. You're going to block them so they don't fall off. And you're going to take into adduction, adduction. Okay? And then you're going to do contract, relax, contract, relax, contract, relax. Do that a number of times. And you can even go into external rotation as well to loosen up the rotator muscles of the hip as well. So, those are 3 things you can do to help your significant other who's having your child, so that way they can continue to move well and live well. If you have any questions with this video, obviously drop them off in the comment section below. We thank you for watching. We appreciate it. If you're new to this channel, hit subscribe. And when you hit subscribe, take it one step further and hit the notifications button as well. And that way you can continue to receive notifications when new videos pop into your feed. And that way you can continue to move well and live well and keep up with what's going on with Move Well, Live Well here. Also, share this with others. I'm sure you know somebody who knows somebody who knows somebody or whatever that has an expectant mother who has hip pain. Don't tell me you don't. So share this with others so that way they can benefit from the video. And if you have any, like I said, if you have any comments, please drop them off in the comment section and give us a like, give us a thumbs up. It lets us know you care. Again, we thank you for watching. We'll appreciate it. We'll see you next time. Take care. Bye-bye.